Assalamu alaikum and welcome back to Medicower. I'm your host Rabina Mir. This is part 2 of the How Your Body Works program on the lungs. And this earlier part of the program we were talking to Dr. James Pickering, who was telling us about not only what do the lungs do but how they work. And then the second part of the program is coming back to our students who we've had on the show before. Welcome back to Neve and to Emily, who are our second year medical students. You're going to help us look at how do we look after the lungs. So one of the things I wanted to ask you about was what kind of things can go wrong with our lungs?
A multitude of things. Obviously you think about how key they were in the explanation. I mean, you have to breathe to live. So you can be exposed to a lot of things that can get into your lungs. Obviously you get colds, that kind of thing that can progress. But there are a lot of pathologies, is what we call them, that can happen with involving the lungs. One of the most common ones is asthma, which I believe Emily was going to talk about.
Okay, so what can you tell us about asthma then? What is it?
So asthma is essentially an inflammatory disease of the airways, so the tubes that lead into the lungs. And basically during this process, the airway, something irritates the airway, and this then makes it sort of angry basically.
Okay.
And it gets angry and it gets a bit swollen up, and obviously being tubes again, like we said with the blood vessels being tubes in the previous programme, these tubes, when they get irritated, they can get narrowed. So this then causes things like shortness of breath, potential breathing difficulties, some wheezing. So they're the typical things that you would experience if you were suffering from asthma.
Yeah. And then what do we need to do for people with asthma? How do we look after people with asthma?
So people with asthma, obviously if they're noticing these kind of things, tend to go to their GP. I believe it's kind of something that's more seen in childhood. It's something like a parent would obviously notice if their child's breathing.
It's more likely to start in childhood.
Of course, yeah. So the parent would more obviously notice something wrong. So when you go to your GP, it's quite often that they'll put you on inhalers, and they will ask you to speak to a designated asthma nurse who's really trained in showing you the best ways to kind of manage your asthma.
So she's a specialist.
She's a specialist nurse that most doctor surgeries have. Just to really manage the condition, because it can be something that is chronic and lasts a long time. And the best way to kind of look after asthma or maybe treat asthma is just to manage it as a condition. When people are essentially newly diagnosed with asthma, they find that there are these things called triggers, which kind of cause those symptoms which Emily was talking about to come on, the things that make you a bit angry. And these can be called something called allergens, and they can be things that you can get a bit irritated, like in the summer when you get hay fever.
Right.
Pollen is something that can irritate people with asthma, so in the summertime, people with asthma can suffer a bit more because they get bad hay fever.
They're breathing in more things to irritate the tubes in the lungs. Right.
But sometimes things such as dust mites, so obviously in the house, if the house is dusty, it can make someone's asthma worse. If they've got a lot of pets, that kind of thing. Just those kind of things can irritate. So there might be advice from your GP surgery to kind of...
What are pets doing that irritate asthma sufferers?
Just the pets kind of being there. They can carry kind of little dust mites themselves.
Oh, I see.
And
so it's not just to do with the hairs, it's more than that.
No, it's just their presence, unfortunately.
Okay.
But then it's just kind of managing that as a lifestyle as well, to help people kind of keep on top of it and make sure they don't have any really bad flare-ups, because asthma can unfortunately be quite serious.
Okay, what else do we need to know about asthma?
I guess maybe the initial difficulty, we've discussed lots of triggers of asthma, and another thing is sort of very cold air can also sort of irritate the lungs, as well as exercise. So if someone's doing vigorous exercise.
Ah, now you've reminded me of when my son was young. I mean, he's an adult now, but I do remember there was a period when he struggled with after exercise, and they called it sports-related asthma, and that he actually did grow out of it. I don't know if that's because he did less exercise or if it was something else, but yes, I remember that happening to my son.
Yeah. And I guess sometimes if there's, obviously these things are naturally all around us, so pollen and animals, like we're exposed to them quite regularly, so identifying which one it is for you that causes your symptoms can be difficult as well. That doesn't really matter in terms of what the treatment options are, but it's also something to bear in mind, because some people are affected by more than one of those triggers. So then they may have to be extra careful to avoid those.
Okay, because you can get people that have got hay fever but they don't have asthma.
Yes.
But you can have, it sounds like what you're saying is you can have asthma that's aggravated or gets worse because of other things, and pollen and things that hay fever sufferers would struggle with would be part of that too.
Yeah, it just can. It's called an exacerbation, so it's a period when something like asthma can just get worse.
Okay.
And unfortunately, things like colds can, as Emily was saying, cold air can affect it. But if someone gets maybe a cough or a cold, it can again make their asthma worse. So it's really important to make sure that if they need treatment, they can have it as well.
You said that asthma's often linked to children, and that's when you might first pick it up. Is there a certain age range where they wouldn't have it?
I'm not entirely sure about that myself,
Okay.
but I think it's one of those things that can just start. I think from maybe like my family experience of people with asthma, it was kind of first noticed, particularly in one cousin. He kept kind of getting recurrent kind of coughs and colds that just wouldn't really go away.
Okay.
And then through a series of kind of diagnoses, it then can end up being asthma. So it
Okay.
is potentially more noticeable in younger children just because, as their parents understand how they are,
Yeah.
and maybe if you're an adult, you kind of just get on with things.
Yeah, you might ignore the symptoms.
Yes.
So it doesn't mean you can't get it as an adult, but
No.
it's not. It can happen quite easily with children. So I
Yeah.
guess it's a case of that trip to the doctor to sort of say this keeps coming up. I'm not quite sure what's going on, and their
Yeah.
investigations would lead to that.
It's very
Okay.
important.
So treatment-wise, what do we do to help? Because you can't take all the pollen out of the air. You can't avoid cats and dogs coming through into your environment sometimes. Even if you don't live with them, there's things in the air wherever we go, aren't there? Pollution is one of the things
Yes.
that I think can aggravate that. So
Yeah.
how do we help people with asthma?
When people are newly diagnosed, they often get given these things called inhalers.
The blue and browns.
The blue and brown, so people often just refer to them as that, but they both do a different job.
Okay.
So the brown inhaler is what's known as a preventer, and it contains a low dose of something called a corticosteroid, which is an anti-inflammatory drug. So other anti-inflammatories you may have heard of are things like ibuprofen, that kind of thing that you take
So
if
they
you've got...
reduce inflammation or swelling.
Yes,
That is what, because when things swell, that's when we've got restriction, haven't we, with breathing?
Exactly.
And, okay. I'm just trying to make sure we have the layman's language.
of course,
so
of
that-
course. So these brown preventers, essentially, when you take them, they're taken more kind of often, just to kind of keep those symptoms at bay, hopefully kind of maybe try and reduce those sensitivities which bring on the symptoms of asthma, essentially.
So what's in the? You said it's an anti-inflammatory. Does it have a name?
There's a corticosteroid, so it's just kind of a
Okay.
brand, but I think it depends on what you get prescribed by your doctor,
But it's a steroid.
which is primarily a
So
low
how
dose
does
steroid.
it work? It just dries things up, or
It just reduces those kind of chemical mechanisms, biochemical mechanisms that cause these kind of signs of inflammation. And these very, very low dose that you take as an inhalation spray, they just kind of keep those inflammatory things, they kind of suppress those inflammatory kind of mechanisms a little bit, just to kind of stop those pathways or things from really flaring up.
So listening to what James said earlier and what you're saying sounds to me like there's irritation going on in the lungs because of asthma, and these drugs are there to help reduce the swelling so that we can get more oxygen into the lungs and help.
Yeah.
And that's why that would help with the breathing, because obviously asthma sufferers are struggling with the breathing, aren't they, most of the time?
Yeah.
Okay.
And then
So what's the blue one about then?
the blue one is what's known as a reliever. So it's taken when someone's maybe feeling their symptoms of asthma really kind of coming up, particularly maybe if they're having an asthma attack. That's why it's so important that they keep them on them. So that contains something that's called a bronchodilator.
Okay.
So broncho is the term that relates to lungs, and then dilator means to get bigger. So as we've been saying, in an asthma attack, your airways kind of close and restrict, and obviously we need them to be nice and wide and open to get as much oxygen in as we can. So this bronchodilator is often something called salbutamol.
Yes, I've heard of that. Yeah.
It's sometimes called Ventolin. I think it just depends
Okay.
on the kind of brand names. But it is just the primarily thing that's taken just to open those airways a bit more if they are becoming restricted. So if someone's feeling that they may be feeling those kind of effects a bit more, they'll take a couple of puffs of them, or however they've been directed by their doctor, and hopefully that should relieve their symptoms. But if someone is with you and they're having a noticeably bad kind of asthma episode, it is sometimes good just to get in contact and get a little bit more help, because these things can turn quite serious sometimes.
So it sounds like if you're diagnosed with asthma, you get given the brown and the blue inhalers. And it sounds like the blue one's the one that you need to keep on you all the time. Is that right?
Yes.
Am I getting this the right way round? Okay.
So Yeah, so the blue one's the one that people use when they feel like they're getting a bit tight.
Okay.
So that's sort of like the instant relief almost. So the brown one is normally taken once or twice a day, just as a precautionary measure to sort of keep that inflammation at bay, essentially. And
so
then
that's preventing things getting worse.
Yeah, it's sort of trying to stop the severe sort of tight feeling coming on at all.
Yeah.
But then unfortunately, if that does come on, then it's the blue one that is responsible for sort of combating that, essentially.
Yeah. And that's why you have to have them on you. That's why the doctors do stress it at you, and you think, oh, it's fine, I'm only popping out to the shops, but you never really know what's going to happen, so it's wise to keep them on you.
I mean, I don't know about you, but as a woman, I'm often changing my handbag, and I'm thinking, if I had it in my handbag, would I remember? So can you have more than one of each, or is that something you have to negotiate with your doctor? Or
I'm not entirely sure, but I feel it's something you could talk to your doctor about. But because it is a prescription medication, things might be a bit different. But it is something maybe you could discuss with your asthma nurse, because I believe people with asthma do have checkups as they need, just to kind of discuss how they're feeling, are they keeping their symptoms at bay, is everything going well, are they using their inhaler correctly?
I was just going to say, because I was thinking that if I was in a situation where somebody told me I needed to take something like an inhaler, I'd be thinking, oh my gosh, how do I use this properly so I know that I'm breathing it in? Because I'm terrible at things like that. So who's the person that's going to help you with that?
Probably your asthma nurse, I think. They're very well trained, and they tell it to all their patients that they see. And because it is such an important thing to get right, they really make sure, and they sometimes ask you to demonstrate back to them how would you use it.
So you get tested on it as well.
A mini test, a very light-hearted, informal test.
But it's important, isn't it? Yeah. There's no point giving you something if you're not using it properly. It's just you're not going to get the benefit of it.
Of course.
Anything about the drugs that, apart from that our audience would benefit from knowing, pros and cons? I don't know if it's something that at your stage of your careers you can answer that, and maybe I'm putting you on the spot with that, but is there anything that, if they have concerns about their drugs, is it something they just need to talk to their doctor about? I'm just thinking about side effects, because we talked about one of them being a steroid.
Potentially if you do have worries, but I'd say more a pharmacist potentially could ask. They've got a wealth of knowledge, and obviously GP appointments can be for different reasons, but definitely pharmacies have so much knowledge. Pharmacists train for 4 years, a really long time.
Yes.
So they do know, and obviously if you do have concerns, it is really important that you share them, because concerns can be something that really build up and maybe make you want to avoid your medicine, and that's not essentially what we want.
Better to talk to somebody than, and you're absolutely right, and pharmacists, of course, you can just turn up at any pharmacist and ask somebody, couldn't you, without having to make an appointment. You might have to wait at the end of the queue, but yeah, that's a really good tip, actually. I think that's one of the tips we should remember for the end of the show. Okay, anything else about asthma that we need to know, or shall we move on to the next category?
I was just going to mention with the technique, we were saying how important it was to make sure that we were talking about adults sort of using it properly. Just thinking about children as well, because we said how common it is in children. They've got special equipment that can be used to sort of help make sure that all of the medicine sort of goes down into the tubes where it needs to be. There's things called spacers.
I remember those. That's one of the things my son had, and it made a rattling noise if you sucked on it properly. Yeah. And if you didn't make a certain noise, I'm trying to remember now. Am I getting this right now? But I'm pretty sure that it was one of these big plastic things that you could see things moving. You could put your stickers on it as well, so it was nice and bright. And it had to make a certain noise for you to know that you'd breathed it in correctly. Is that what we're talking about?
Yeah. I mean, I had one when I was younger. I'm sure they're much smaller now than they would have been when I was younger. But it was sort of a dome shape, and you sprayed the inhaler in one end and had a mouthpiece on the other end.
Right, yes.
So you sort of put your 2 puffs into it, and then sort of took, I think it was 5 breaths in and out to make sure that all of the medication had gone where it needs to be. And I would just say that that's really important for children, to make sure that they're getting what they need, because the technique is really difficult, and I struggled with it until I was about 13. So.
Did it taste of anything?
It does have a taste, yeah. I wouldn't know how to describe it.
No. I don't remember my son ever not using it because of the taste though, so it can't be that bad if he continued to use it. So let's hope it doesn't taste bad then.
I was going to say, with the side effects as well, I would imagine that most people with asthma would find the benefits outweigh any problems. So I would I would probably say that any advice given would be to sort of encourage them to carry on using it. Because obviously the benefits are obvious with breathing and things.
Yeah, and there's no denying how important this medication can
definitely.
be. If you didn't have medication, would there be other means of helping you with breathing?
I'm not entirely sure, but I feel obviously GPs and your asthma nurse will give you the best advice. So I feel I'm not at the stage yet where I can really dictate or say, but there potentially may be just different ways to manage it. I think sometimes people try air purifiers, that kind of thing, but...
And steam might be one of them, mightn't there?
Yeah, I'm not entirely sure how much of a difference that would make. But
I appreciate I'm putting you on the spot with that one, not to worry.
I mean,
Okay,
other
I think...
advice just includes avoiding the triggers, which I know that's not the most practical thing, and especially if you're not really aware of what is causing it, but I guess that is another option if, you know, if you've got pets at home that are causing aggravation, maybe to sort of consider
changing
lifestyles. But I appreciate that that's really not practical.
It's about prioritising it though, isn't it? You know, at the end of the day, if we know that there's something's going to aggravate us, then we're going to do what we need to do to reduce it. But it is about being proactive on that, isn't it, as well? And it's like everything, isn't it? It's easier said than done, and especially if it's children, it's even harder if it's a loved pet or something. But I can see why we need to think about those things. So we mustn't avoid it just because it's hard, mustn't we? Okay. I think one of the things I wanted to bring into this conversation is the topic that everybody knows about, but actually it's really hard to get people to change this habit, and that's smoking. So tell me, I think I know why smoking's a problem, but I want you to tell me why is smoking such a problem for our lungs?
So cigarettes, there's so many things in cigarettes in terms of components, but the big two kind of things you need to worry about in terms of your health are something called the tar element of it, which comes from smoking, potentially like tobacco mostly, and then the nicotine effects of it. So nicotine is what's known as a stimulant drug, so that's why sometimes people like having a cigarette to make them feel a bit more alert and awake, and it's sometimes why that if people haven't had a cigarette they can sometimes get a little bit shaky. So as a stimulant, nicotine kind of can, back to tubes again, it kind of tightens your blood vessels a bit and gets your heart pumping a bit more, so it can increase your blood pressure. And then the tar element of it, tar's quite complex in how it...
I think of tar like the tar on the road, that sticky treacly thing.
It's essentially that in your lungs, isn't it?
And so is this the poison part of...
Pretty much.
There's so many things in cigarettes. I mean, so many chemicals that are bad for us, and some of these are even termed carcinogenic, which actually means that they're cancer causing. So some of the chemicals within the cigarette smoke that we expose ourselves to can actually increase our risk of sort of getting lung cancer and things like that, which is obviously a huge thing to think about. In terms of the tar element and things, the chemicals can irritate your lungs, like we were saying about asthma. And also I think what's really important to talk about is these special cells called cilia. I don't know if you'd have heard of them, but they're essentially special cells, and they've got like finger projections on them, and their job is to sort of, they beat back and forward, and they sort of propel the mucus up your airways ready to cough out. And the chemicals in cigarette smoke actually kills these, essentially.
That tar element can flatten them as well, because it's sticky and it traps them down.
Smokers cough a lot, don't they? They cough a lot of sputum out. So
they do, unfortunately.
And that's what the cause is. So these cilia have died, so the cells become flat, so there's no sort of waving up the mucus up your trachea. So then obviously it sort of accumulates in the tubes, and then that's
it then irritates as well, and your body obviously wants to get rid of that mucus. It knows it's something that's not meant to be there, and so it's trying to cough, but it's not really going to go anywhere, unfortunately, because it's not.
So this is another
cells.
Harm.
So that's what's termed the smoker's cough, essentially, because it's hard to clear this mucus. That's kind of what happens.
Does it take a long time for that to happen, or do you have to, is it about how many you smoke in a day that would sort of make that happen sooner?
I think as soon as you start smoking cigarettes, from smoking kind of cessation or smoking stopping campaigns, the benefits I think even 24 hours after you've not touched a cigarette are already remarkably different. It's possible for you to breathe clearer and that kind of thing. And one thing we didn't actually touch on is the actual smoke that you take in contains something called carbon monoxide.
Which is a poison.
Which is a poison. So what it does is, Dr. Pickering was talking about how oxygen binds to something called hemoglobin.
Yeah.
And unfortunately, carbon monoxide can take up that hemoglobin spot. So then what's known as your oxygen carrying ability is reduced when you're smoking, because that
So
carbon
the magnet
monoxide
doesn't stick to the oxygen.
the magnet doesn't stick because it's blocked by this
carbon dioxide.
carbon monoxide.
So that's why breathing is
Monoxide.
another complication of smoking.
Yeah,
Poor breathing, should I say.
unfortunately, yeah.
How does smoking change the... Because I've seen pictures where you get shown this nice pink lung and then you get shown this really nasty looking dark black coloured lung. So is that somebody that's been smoking heavily for a long time, or would that happen fairly soon?
I believe it's someone that probably has been smoking for
Yeah.
quite a long time. But I think even if you are maybe having 5 cigarettes a day, it still will do a bit of damage to your lungs. We've been shown kind of a variety of pictures through our training of kind of lungs at different stages. And even people that have maybe not smoked for very long will still have maybe not completely black lungs, but there'll still be little patches on them where there's been some damage done, which is just very unfortunate, really. You want those healthy pink lungs.
Yeah, because they absorb the most oxygen.
Yes.
So if you stopped smoking, would you be able to get your lungs back to be pink again, or is too late?
I think it depends on how many you've smoked, or sometimes even what you've smoked. But I think it can be possible to kind of turn your lungs around, not maybe in a drastic enough way, but you can return to better health. I mean, as I was saying, if you don't touch a cigarette for 24 hours, your body will start to notice the difference, and it probably will be very grateful for it as well.
I think in terms of the appearance of the lung that you're talking about with the blackness and things like that, that's caused by the carbon that's in the smoke. But in terms of sort of reversing that, I don't think the appearance of the lung would change if you stopped smoking. I think it's more the health benefits that we're talking about. So the smoker's cough may improve, and obviously the risk of cancer would reduce. So it's more of sort of the things that affect your health rather than the actual appearance of the lung itself that would see an improvement.
Yeah,
We're very quickly coming towards the end of the show again, and I don't want to actually not ask you about shisha. And I know, Niamh, you know a little bit about this, because this is a really growing issue within the communities that I'm from.
Yeah.
And a lot of our young people seem to think that because they're based on fruit that actually they're not harmful. Is shisha harmful to our lungs?
Unfortunately, it is. I know it is seen sometimes as a healthier option. It's a comfortable thing to do, an enjoyable thing to do. The World Health Organization, which kind of governs medical bodies everywhere and kind of has its say on medical issues, has said that an hour of shisha, or being kind of around shisha for an hour, is equivalent to smoking 100 cigarettes in one
Seriously?
go. In all honesty,
Even if you're not smoking it yourself?
Even if you're not smoking, well, I think more if you're smoking yourself, then it's that exposure to 100 cigarettes. But an unfortunate side effect of being in a shisha lounge is that you are really subject to passive smoking because it's indoors.
Yeah.
You're surrounded by that. So even if you've gone maybe just to have a fruit platter or something with your friends, if you're being surrounded by that, you're still taking on those nasty gases that are in the smoke, and that can also damage your lungs. And even though it is fruit-based, because they add kind of flavours and things to it, you are still having that tobacco, which kind of dampens down your lungs, and you're still also, they use charcoals or wood, and that's really harmful to your lungs. That kind of coaly substance, carbony substance can really damage as well. So shisha unfortunately isn't as healthy as you think it might be.
That's really helpful to know, because I think that's one of the myths within our community, that actually the shisha is something that actually isn't as harmful as cigarettes. So thank you so much for looking into that for us and sharing that. I need to ask you for your top tips before we can say goodbye. What individually, any top tips from you on the subject today?
I think it's already been said really with the blue inhalers, just making sure that just pop them in your bag when you're going out and things. Just make sure they're really on you all the time, because if you do sort of suddenly feel those symptoms coming on, it's really important that you can relieve them straight away.
Sure.
So definitely that would be my top tip.
Thank you so much, Emily.
And
Niamh?
I'd probably say my top tip would be try to stop smoking if you can. I understand it's a hard thing to do. It's a really hard habit to kick particularly if you're having cigarettes with nicotine in them. But definitely try, maybe cut down, and if you don't feel like you can do it yourself, a lot of GP surgeries have really great smoking cessation nurses and advisors that come in. So definitely speak to them, because you will feel the health benefits from it.
Thank you so much. Really appreciate you both being here today.
Thank you.
Thank you.
Okay, so unfortunately that brings us to the end of the show. Please feel free to ring the station and let us know if there's any subjects that you want us to cover in Medicower. I'm more than happy to hear from you. In the meantime, I look forward to seeing you again, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuhu.